It's okay. Okay.
Thank you, ladies and gentlemen, for tuning in to Ask for Anything segment, and thank you to Professor Paul Tambaya for coming into this live to address Singaporean concerns on COVID-19 and its vaccines. So, but before we start, let me give you a bit of description of Prof. Paul Tambaya. So, he is a professor of medicine and also an infectious disease specialist. He is also a president-elect of International Society of Infectious Disease. In addition, he is also the current chairman of Singapore Democratic Party and GE 2020 candidate for Bukit Panjang and SMC. So before we start, there are a few questions and overwhelming response from most of you, and we would be having another session on the 9th of February 2021 at exactly 8 p.m. to address the remaining questions. Yes, but before we start also, let me introduce myself. My name is Akmal, a volunteer in Bukit Panjang SMC and also a youth advocate. So, Professor Paul, can we start?
Sure. Thanks very much, Akmal, and thank you all of you for sending your questions. Again, as Akmal said, we'll try and address all of the questions, but I'm sure we won't be able to. So don't worry, if you don't hear your question today, you'll hear it next week.
Alright, so let's start with the first question by Meng Xiang. So, what is mRNA and how does it work?
Yeah, basically mRNA is like the postman. Our body has a series of instructions coded in our DNA, and for viruses it's in RNA. And what happens is it uses the postman to tell the body how to produce the protein. So what this vaccine does is it takes the mRNA from the virus, it injects it into the person, and so we produce the virus protein to train our immune system so it can recognize the virus when it comes and it can destroy it. So that's basically it.
Alright, so following up to that question, is it something new that the public doesn't know about?
Well, it's a new technology. It's never been used in vaccines before. And for 10 years, this company tried to use it actually for cancer vaccine. They tried it for a couple of other viruses, but it was still very early in development. And in fact, this is the first time it's actually being used in treating or actually preventing a virus infection.
Alright, that's very insightful. So the second question by Muhammad Sohaili is that how long does vaccine last and how frequently do we need to take them?
Well, as far as we know, this whole virus has only appeared 1 year ago. So we have no idea how long the immunity would last. There are some data that shows that people who are infected, they are immune for maybe six months or more. I personally think that we're going to be protected for maybe 8 to 10 years. But we don't know because, again, it's too early to tell.
Alright, so following up to that question also, will there be a scenario where the second dose is not available after we have taken the first one?
Yeah, in Singapore, I don't think that's going to be the case. Right now, there's only one type of vaccine that's approved by the HSA. And so everybody has got enough for 2 doses as they are progressively rolling it out. But again, we don't know. There's a lot of very strict conditions. The virus has to be carried in dry ice, so it's at minus 70 degrees. If there's a break in the cold chain, they have to throw away the virus. Sorry, the vaccine, because it's not effective if it's not kept according to the cold chain. So vaccine must be maintained, and then once it's been transported to the site, it can be kept in a fridge. But again, you have to, once you've opened the vial, you have to use it within a period of time.
Alright, so just to give you a little bit more info, so recently there has been people commenting that there has been several cases also which tested negative and then positive. So would these people be infectious between these 2 periods?
Yes, they would, because a test is like a snapshot. So you don't know if they tested negative, say on Monday, and then positive on Friday. You don't know whether they turned positive on Tuesday, Wednesday, Thursday.
Right.
So if they happen to turn positive on Tuesday, then it's just your bad luck. See, Tuesday, Wednesday, Thursday, they're infectious. But if they turn positive only on Friday, then you're lucky.
Oh, alright. Okay, we have 4 questions by Ann Lim from Ann Lim.
Okay.
So the first one would be, the swab tests done are no longer like before. They take the swab at the tip of the nose now, and are these as accurate as the previous swab test?
Yeah, that's easy. The current gold standard is the old one, which is the nasopharynx, where you go right up to the top, and then you get the part where the nose meets the throat, and that is considered the gold standard. There is this test known as the mid-turbinate, where she's talking about near the tip of the nose, and that is pretty close. It's not as good as the nasopharynx, but it is pretty good. It's less uncomfortable, so people find it easier to take.
Okay, I think the next question will be interesting by her also, or him. Okay, so why are they not, like those who are tested, not allowed to drink, eat, or smoke half an hour before the test?
Yeah, so the reason why they're not allowed to smoke is the smoke will get in, through your nose, and it may destroy the cells. So, so they may not be able to. It will actually give you what we call a false negative, because the heat actually kills the virus. So if you smoke, the smoke kills the virus for that period of time. So even though you actually have the virus, when they put in the swab, they miss the virus, you see, because the virus is hiding or is underneath the cells which have been killed. In terms of eating or drinking, the most likely reason is they're afraid you're going to choke. You see, if you haven't, if the food hasn't really gone down, and then they most of the time when a swab is done, you actually feel like you want to gag,
Right.
if they go all the way in. So if you gag and then you've got food inside there, the food may go down the wrong way, and that's very dangerous.
Alright, okay, and very insightful also. Okay, the second question is that the timeline for the vaccine was too fast, or I would say it's too fast. So hence, there is insufficient evidence on the long-term effects of the vaccine. Do you agree, or what are your views on this?
Yeah, in a way, she's partly correct. In that, the ideal situation would be you run through the vaccine, but and then you watch for the long-term side effects. The FDA actually wanted 2 months to make sure they saw 2 months of side effects, and they are still monitoring the people who got the vaccines in the clinical trials. But in actual fact, the vaccine development started with the original SARS 17 years ago, and the target of this vaccine is it's very similar to the target that was used for the original SARS vaccine. So in 2004, 2005, there was a lot of effort to develop a SARS vaccine. But then when SARS disappeared, there was no more SARS vaccine. See, there was no more money in it. Nobody was interested in it. So what happened was when COVID appeared, then people dug out these developments, and then they started further developing them. So it's not entirely true that this vaccine just came out of the blue in 1 year. It actually is 17 years in the development. There are a couple of steps that they short-circuited. Like, for example, the number of monkeys that were tested is actually relatively small. Pfizer tested, I think, a handful, less than 10 monkeys. And they haven't published the data of what happened when they vaccinated the monkeys and then they infected them with the virus. So we don't know whether the vaccinated monkeys had more of a reaction or but we do know that they had less virus in them, which is why they went on to the human studies. So there's a few details that are missing, but I think there's continuous monitoring. So hopefully we'll get more information as time goes along.
All right. Okay, we'll wait for that.
Yep.
So okay, the third question from Anne is that some time ago, media reported about frozen food having the virus itself, and it is the Aussies or the Kiwis who actually had a few cases out of nowhere. So it's an unrelated case. Could they have been infected because they touched the surface of this food, or because she doesn't recall reading any updates on this?
Yeah, so there's actually researchers from Singapore who have shown that the virus can survive on frozen food for a very long time. But the simple answer to that is don't handle frozen food and put your hands straight into your mouth or nose, you see. And you should ideally wash your hands.
Yes.
After handling raw food, whatever, whether it's frozen or non-frozen, it's always very important to clean your hands. And if you do, you're not going to get infected.
All right.
Because the hand rub, the disinfectant, the soap and water is going to kill the virus.
Alright, this is relating to food, but how about normal surfaces like the table and chairs?
Yeah, same thing. You see, when you handle a table or chair, ideally, if it's something which hasn't been wiped down, then you should use some hand rub or hand sanitizer before handling food or before touching your face. And in fact, that's one of the benefits of masks, because the mask actually prevents you from touching your nose and your mouth. So you handle a table and then you want to touch your nose and your mouth. If you're wearing a mask, you're not going to touch it.
Alright, okay. So, all this while we have been hearing in the news where there's new strains, especially in the UK, and also identified in Singapore somehow. So will the vaccines be effective to fight against these new strains?
Yeah, at the moment, there seems to be evidence suggesting that the vaccines are effective. There's studies done by the companies which make the vaccine, which obviously want to show that the vaccine is effective. There was one study done by Rockefeller University in New York, where they showed that the vaccine was effective, but it's less effective against the new strains as it is against the old strains. So you may have heard that one of the companies is actually going to modify the vaccine. so that the second dose may be more effective against the new strains. But again, all of this is lab data. See, we don't know what's going to happen in real life. And personally, I think this virus mutates a lot less than, say, for example, the flu virus. So, we have different strains of the measles and mumps viruses,
Right.
but the MMR vaccine works for all of them. So, I'm an optimist. So I hope that this vaccine is going to work for all the different strains
All right.
in real life compared to in the lab.
So with that, should we actually take the vaccine now if we think that the COVID will actually mutate?
Yeah, I think we should. And part of the reason is these new strains, they appeared even before the vaccine was rolled out. So these new strains are not a response to the vaccine. They're just part of the natural history or the natural evolution of the virus. So, trying to stay one step ahead of the virus or waiting until the latest mutation occurs is not going to work. See? And basically what we need to do is, I personally think we take whatever's available. Because, the bottom line is all of us want to get back to normal.
Right.
And I think the only way we're really going to get back to normal as a global population is if we have control of the virus. And I think the most effective way to do that probably is going to be through vaccination.
Alright, so vaccination also is the way lah.
Yeah.
Okay, next question by Lim Titus is actually regarding on the cause of COVID-19. So exactly what he question us here is that there are reports that the vaccine caused adverse reactions, and MOH mentioned that there are 432 people with adverse reactions after the vaccine. So what are these side effects or adverse reactions, and how do they become about? How do they come about, and what are the views on this?
Yeah, so there are different kinds of adverse reactions. The most common adverse reaction is actually pain at the site of the injection. And I can tell you, I got my injection about 2 weeks ago, and I had pain for about 3 hours. It was running down my arm, but by the night time it was okay. So pain at the site of the injection is a common side effect. There are other side effects that people have had. Sometimes people feel dizzy, people faint, and that happens with other injections as well. The one that seems to be more common with this vaccine than with other vaccines is severe allergic reactions. So again, MOH mentioned that there were 4 individuals with severe allergic reactions. And these individuals were people who had previous history of allergic reactions. So I think right now the vaccinators are being very cautious, and they are not giving the vaccine to people who have had quite severe allergic reactions, like to seafood or to drugs or medications or things like that.
All right. Okay, the next question is by Yong Teck Lo also, and is regarding about the differences between how the governments view this. So in Germany, they discourage citizens above 65 to take the vaccine based on lack of scientific studies for this age group. However, in Singapore, citizens above 70 are prioritized for this vaccine. So what are your views on this?
Yeah, with every decision, it's actually got to be weighing the risk versus the benefits. And it's kind of a paradox. On the one hand, the elderly are at higher risk of complications. Certain complications though, the allergic reactions tend to be more common in the young. Children tend to have more allergies than adults. So similarly, if you may have read from the MOH statement, most of those who had the severe allergic reaction were in their 20s and 30s.
Okay.
So allergy aside, there have been reports from Norway about elderly people who die after the vaccination. And part of the thinking was that these people are frail to begin with. So if they get pain in the arm, or they get fever, or they get tiredness, then that may tip them over. And that may be the rationale behind Germany prioritizing the younger people. Whereas in Singapore, the decision was made to give the older people the vaccine. But on the other hand, they were not the first. The first were the frontline workers, and then the politicians, and then the Changi Airport people. And so we had some time to see how the local population would react to the vaccine before it was given to those over 70. And again, like I said, they are pretty careful in who they give the vaccine to. They go through the screening questionnaire, and if you're not well, you cannot get the vaccine.
All right. Okay, this next question is similar, but I think he wants to know more in depth on the eligibility of the people who are eligible for vaccine. So this question comes from Bala Subramanian, and he asked, who should take the vaccines and who should not. So he continued by saying that we have the following group of people who have the same questions, such as the elderly in good health and rarely goes out, and patients with diseases such as diabetes, Parkinson, and also stomach ulcer. So
Yeah, so the elderly who rarely go out, theoretically, I think they're trying to say that their risk is low. But even if people don't go out, people come and visit you. See? So you're not going to make sure that people show you there's vaccination cert before they come and visit you. So I think if they're in good health, there's really no good reason why they should not get vaccinated. So if you get a letter from the MOH telling you that you should go for your vaccination, you should consult your GP or your primary care doctor to see whether you're suitable for the vaccination. And I think if the GP thinks that it's okay, you should go ahead and do it. Now, in terms of other illnesses, like I said, the number one thing that they're being cautious about is severe allergies. There's an issue about like blood thinners. So a lot of people are on aspirin. People who have heart disease or people who have stroke, they're on aspirin. And the main thing is you need to press on the arm a bit longer because otherwise you can get bruising or bleeding. But there's no evidence that, there was that one case of a doctor in Florida who had bleeding following the vaccine. But so far there have been no other cases. And we don't know whether that was directly related to the vaccine or not. So I think with people on blood thinners, you need to tell the vaccinator or you tell your doctor that you're on blood thinners, and then they can monitor you.
Alright, okay, that's good. Next question is by Joe Wang. Is this vaccine suitable for transplant patient taking daily immune suppressants?
Yeah, at the moment, we are actually encouraging people who transplant, who are stable, to go ahead and get vaccinated. There's some concern that people who are on very strong immune suppressant, that means they just got transplanted or they had an episode of transplant rejection and then they're given extra drugs, the vaccine, they will not be able to mount an immune response. In other words, you give them the vaccine and then it's no use. And then they get a false sense of security, they don't wear their mask, they go and low A with everybody and things like that. So I think right now, again, it's best to discuss this with your doctor, and then they can make a risk assessment for you.
Alright, so risk assessment aside, what are the alternatives for these patients?
Yeah, so the alternatives, obviously, what we do with other vaccines, like the oral polio vaccine, which is given to babies. If you are somebody who's a grandparent of a kid who's going to get the oral polio vaccine, you cannot change the baby's diaper because you run the risk of getting infected with the baby's vaccine. And then, so you have to be careful, practice good hand hygiene, make sure you don't put yourself at exposure, especially to people in your own family. The other thing that we do, like for example, the chickenpox vaccine, which cannot be given to transplant recipients or people whose immune system is weakened. So what we do is we vaccinate the whole family. So if everybody in your family is protected, then the chances that you will get infected are low. Because most people who get infected from their household members.
Alright. Okay, the other question by Klein is that why do you think the world or the government is so confident that the vaccine, which took only 1 year to develop, is safe and effective?
Yeah, so again, as I mentioned earlier, the vaccine took 1 year to develop, but it's based on science that has been around for 17 years from the original SARS itself. I think, it's a mixture of confidence and desperation, because the whole economy of the world is shut down. There's no travel, and we really need to move forward. And one way of thinking about it is this vaccine may actually be version 1.0. So even as the vaccine is being rolled out, there's a lot of monitoring going on. And as I mentioned with the new strains, one of the companies has already announced that they're going to modify the vaccine. So the next round will have a different kind of target. So again, I agree, it's not an ideal situation. But we have no choice really in that sense, because we cannot continue like this with all the lockdowns and the no travel. So many people haven't even seen their family for months, and that's really it's got very severe consequences.
Alright. So the next question is by Jennifer Koh. In October 2020, Singapore halted 2 flu vaccines after 48 deaths in South Korea. So with the death in Norway, Germany and US relating to the vaccine actually, why is there not a halt at this time? And it seems to her that we are not left with a choice. So what are your views?
Okay, a couple of points. We halted the flu vaccine from after the South Korean incident But when they talked to the Korean authorities, they followed up with the data, they resumed the vaccination. So the flu vaccination resumed after about a week or so. So similarly with the Norway cases, with the Germany cases and the US cases, they have been talking to the authorities. So Norway is outside the EU, Germany is part of the European Union, and the US has the CDC, which updates its website on a regular basis. So at the moment, there doesn't seem to be a signal which is strong enough to make them halt the vaccine. But like I said, the fact that they halted the flu vaccine just a little over a month ago gives me some confidence that they would halt it if they saw anything serious. Now the second point is that they deliberately made the vaccine voluntary. Although in typical Singapore style, they said that if you don't take the free vaccine now, the next time around you got to pay for it. See? So in a way, even among healthcare workers, the vaccination is not mandatory. So you still have a choice, see, regardless. I mean, of course, if you want it free, you got no choice. But you have the choice to say no, and then later on you may be able to. You have to pay for it.
All right. So the next question relates to someone who is expecting a baby. So, two questions in one question bar. Should someone who is still nursing their baby take the vaccine? And the second question relating to this question also is, why are pregnant women not advisable to take the vaccine?
Yeah, I'll take the second question first. So the reason why pregnant women are not advised to take the vaccine is because there were no studies done on pregnant women. But when they did the large clinical trial of 30 over 1,000 people, some of these women became pregnant even though they didn't plan on becoming pregnant. And so far, it's still very early. We have no signal that there's increased damage to the fetus. But we've got to wait 9 months to see what happens, whether the babies are okay. So until we have that information, the authorities are being a bit cautious, and they're saying you should avoid giving the vaccine to pregnant women. The issue of breastfeeding is interesting, because what I think a lot of the doctors are recommending is you express and throw for the first 5 days, because they don't know, and it's not so much the vaccine itself, because it takes a while for the body to produce the antibodies. But they're worried that maybe something around the lipid or the carrier or the preservative that's used in the vaccine may be passed on to the baby. But after 5 or 6 days, then they say go ahead, breastfeed. And the rationale is that what's going to happen is you produce antibodies, and these antibodies will protect the baby, which is why breastfeeding is recommended in general, because it provides the kind of antibody protection that you cannot get from formula milk.
All right, just to clarify further, so if this person or the one who's asking question is that if I were to have kids in future, will the vaccine or mRNA have an effect of the future baby growing in her?
It cannot. As I mentioned earlier, the mRNA is the postman. So what it does is it takes the instructions from either the virus RNA or from the body's DNA, and it makes protein. It doesn't go backwards the other way around. See? And the other thing is that the mRNA, if you remember from your biology lessons or your science class, the cell has got a nucleus in the middle, and then outside it is the cytoplasm. So the mRNA cannot get into the nucleus, and the nucleus is where the genetic material is. So if it cannot get into the nucleus, it's not going to affect the DNA, because that's where the DNA is kept in the nucleus. So it's just swimming around in the cytoplasm, and it's helping the body to make protein.
Right.
So there's other concerns with mRNA. Actually, it's not so much the mRNA, because the mRNA will be digested very quickly, but it's more with the lipid that's surrounding the mRNA, and these are things that we need to monitor and to follow over a period of time.
Alright, so remember viewers, it doesn't affect your future baby.
That's right.
Yeah? Okay. So the next question leading on is okay, this is similar to the first few questions, so let's move on. Alright, so for patients who develop side effects after the first dosage, will the second dosage become a booster and aggravate the side effects, or should they stay away from the second dosage altogether?
Yeah, so this is a very good question, because we've had individuals who get severe allergic reactions to the first dose. And I think the current recommendation is you should not get the same vaccine for the second dose. Because if you've got a severe allergic reaction, then you get another dose, the chances that you get another severe allergic reaction is quite high. So if you just got a little bit of itch or something like that, then maybe you can go ahead and do that. But you need to tell your doctor so they can monitor you closely. See. So in fact, now they are recommending that people don't mix and match. I think one of the questions earlier on was about that. Supposing you don't have a stock for the second vaccine. But this will be one situation when you might need to. If you've got a severe allergic reaction to, say, Pfizer, then maybe you need to switch to a different vaccine for the second time round.
Alright. Okay, Ken. So, next question is on your opinion or your views on potential long-term effects, and for example, fertility, and also, is there any long-term side effects currently that proven that 3 to 5 years after vaccination?
Yeah, I mean, like I said, we don't know. See, we can only extrapolate. And the thinking, and actually that's why in the clinical trials they do lots of blood tests and they do lots of monitoring just to see if there's any signal. But and most vaccines, the side effects are usually pretty quick. The vaccines that have had complications, they usually appear either within the first few minutes, those are the severe allergic reactions, or within the first few days or weeks. And that's why the US FDA made them wait for 2 months before they actually wanted to consider the vaccine for approval. So it is possible that there will be long-term side effects, but it's unlikely because, again, we don't see that with many of the other vaccinations.
All right, sure. Okay, this question is very interesting to me because it relates to compensation. So the government has recently set up a fund for compensation who suffer side effects of this vaccination. So the question is, why do you think this is the case, and is this an admission that the vaccine is not safe?
There's an interesting history behind this, see, and part of the thing is something which I'm not too happy about, which is that the vaccine companies have kind of demanded this in order for them to go ahead and develop vaccines. Because normally when you take a drug, you're sick, then you take the medication. See? So you're willing to take a certain amount of risk because if you don't take the medication, you get sicker. Like chemotherapy. Chemotherapy has a lot of side effects. You lose your hair, you start vomiting. You're willing to do that because otherwise the cancer will eat up your body and you'll die. But on the other hand, vaccines are given to healthy people. These are people who are not sick. And what they are doing is they are given to a healthy person to try and prevent them from getting an illness, which they may or may not ever get. So the risk-benefit equation is very different. And this whole issue of compensation came about in 1976 when the United States thought that they were going to have a pandemic of swine flu because they had a young army guy who died from swine flu. And then they had a few cases of bad pneumonia, so they thought there was going to be this swine flu. So they vaccinated millions of people across the United States, and there was no swine flu. There was less than 100 cases of swine flu, but unfortunately a rare side effect occurred. And there were more than 100 cases of this rare side effect. So these people tried to sue the vaccine manufacturers. So the US government took on the liability.
Right.
Because otherwise the vaccine manufacturers said, forget it, we're not going to make vaccines anymore. And unfortunately, this is the way the system of healthcare in the United States and in many, many parts of the world is like that. See, we depend too much on the private sector. A lot of things, and again, this is where I'm wearing my SDP hat. See, I think that healthcare is a fundamental human right, and protecting our health is like defense. You see, but none of us is going to outsource our defense to different companies, and if you don't pay the company, they don't defend you. You see, so I think this is a responsibility of the government. But unfortunately, not just in Singapore, but all over the world, governments have kind of outsourced this to the companies. And so that's the reason why the governments have to provide compensation, because the companies are not willing to do that.
Alright. Okay, talking about companies or the private sector. So this person has issues with her current job or current employers actually asking him or her to actually take the vaccine, or else the jobs will be compromised. Their job will be compromised. So in this case, if the employees have side effects from the vaccines, do you think the company is liable for it?
Yeah, I mean, this is a philosophical question. Right now, the government has not said it's compulsory. So if the government doesn't say it's compulsory, your company says it's compulsory, theoretically your company should be at fault if something happens. But again, for some perspective, we had more than 100,000 people vaccinated. Only 4 of them had severe reactions. So that's 99,000 people who had no severe reactions. So the severe reactions are uncommon, but if it happens to you, it's 100%, right? So I think that the companies need to be very careful about this. I'm not a lawyer, so I can't tell you whether the company will be able to get away and say, oh, the government should pay the compensation. But in a way, the government has kind of preempted that by setting up this compensation fund. There's some issues about the mechanism and how much compensation is provided. But again, this is something that we need to deal with as a society.
All right. So, okay. Moving back to your own views on this issue itself. So, what are your thoughts on the order of distribution of vaccines, such as the person explained more on frontline workers were given first, and then the elderly. Then some reports said that there were people who are under the green list. So, it seems like it's a random criteria for this person, lah. What do you think?
Yeah, this is actually very interesting because one of the things about Norway is they started vaccinating nursing home patients first. So their logic was because nursing home patients are vulnerable to complications. But on the other hand, nursing home patients are not only vulnerable to complications of the disease, they're also vulnerable to anything else, you see. So that's why you had these higher incidents of deaths in Norway, and then everyone panicked. On the other hand, Indonesia decided to vaccinate young people first. And their rationale was that young people can take complications of vaccination. And if you vaccinate the young people, they're not going to bring the virus home to their grandparents. So it's a kind of, one of the scientists actually described it. He said we're all living in a big experiment in a way, because we don't know. This is a new virus, this is a new vaccine. So we are trying to learn. And the key is to get yourself well informed from reliable sources. You see. So most of these government ministries of health, they will publish data with different degrees of information. So you can go to the Norway Ministry of Health is fantastic. They had frequent updates as to what was happening, who were the people involved, what was the rate of complications. The US CDC also, they update this thing in real time almost. So you can get some pretty good information about that. So Singapore's decision was frontline workers, and then you have people like the ministers, and part of the reason why the ministers, in some countries they use the celebrities, and the idea is to persuade people to get vaccinated. And again, like I mentioned, you see, Singapore is very dependent on trade and tourism, and the hotels, they are really suffering. I mean, this afternoon I was at Suntec. We were talking about a convention that we're going to hold next year. And the place was deserted, I mean, and I feel really bad for the people involved in the convention industry, because it's been months since they've had a real life convention, so it's really tough for them. So I think there has to be a way that you prioritize certain individuals. What would be nice if it was transparent? See, if everybody knew, what was the priority, where would I come from? And I think, unfortunately, the system here is such that they don't trust the people. They think people try and jump queue. And unfortunately, it has happened. You may have read the story about the Canadian billionaire who flew out to the remote areas to try and jump the queue. So there's a fear that people might jump the queue if you publicize it, but I don't think that's going to be the case, because Singaporeans are pretty rational. And even if they're not rational, you got all the stompers and you got people on social media who will attack them if they try and do something funny. So I think the strategy sounds reasonable, but it would have been good if it had been shared in a broader kind of way.
All right, and that was actually leading to the second question on transparency.
Right.
But I will skip that question and move on to the next question. So, is there any news yet on how long the vaccine can last? And leading to the next question also is that, what's the most likely situation, and will all of us eventually develop herd immunity, or will we have to take the vaccine every year?
Yeah, as I mentioned, you see, this virus doesn't mutate as fast as the flu virus. So I think there's a good chance that this immunity will last for maybe at least 8 to 10 years. We don't know for sure, but there are similar viruses, the common cold viruses. Children get the common cold and then they don't get the cold again for a very long time. So there is a suggestion that this immunity will last for some time, but again, it's a lot of that is speculation, and it's based on extrapolation of data from other viruses. But I think that it's highly unlikely that we'll have to get vaccinated every year.
All right. So the next question that relates to the first two questions is, what do you think the best possibility of in the next 5 years?
Yeah, I mean, I think the best possibility is that, the vaccine is rolled out all across the world and the virus disappears, and there's a good chance that that will happen. In the 1950s, there were polio epidemics in Singapore, in the US, in many high-income countries, and at that time there was no vaccine. And there were two competing vaccines that were out there. There was the Salk vaccine, which was the injectable vaccine, and there was the Sabin vaccine, which is the oral vaccine. And the vaccines were trialed in the US and for the injectable, and in Singapore and Russia, interestingly enough, for the oral vaccine. And they were highly effective because within a couple of years, that was it. No more polio. The last case of polio in Singapore was 40 years ago. So, and that was through the use of vaccines. So now polio is only circulating in two countries, in Pakistan and Afghanistan. All the rest of the world, the whole of Africa has not had a wild-type polio case for years. So I think it's possible. And like I said, I'm an optimist. So best case scenario, the vaccine is rolled out all across the world, the virus disappears.
On another note, what is the worst case scenario for you?
Yeah, worst case scenario is that the vaccine is not rolled out properly, that there's some side effects, that the vaccine ends up actually causing more problems than like, for example, the dengue vaccine, where you end up with certain individuals who got vaccinated, when they get infected, it gets worse. I mean, that's really a worst case scenario, and I sincerely hope it doesn't happen.
All right. Yes, we all don't want that to happen, right? Okay, next question is relating to travel and the use of vaccine. So, this person wanted to know if there will come a time where the COVID-19 vaccine would not matter anymore. For example, like similar to influenza vaccine, where it does not make any difference since influenza is not really considered lethal anymore. So, if you take it or not before traveling, if yes, may he or she know when would this happen in terms of years or decades?
Yeah, I think people are hoping that this will happen by the middle of this year. That the vaccine will be a requirement for travel. And there's a precedent for that. If any of you have ever been to Brazil or to Central Africa, you know that you have to get yellow fever vaccination. And there's a WHO booklet, a yellow booklet, where you have to certify that you've been yellow fever vaccinated. Singaporeans who go on the Hajj and the Umrah, you have to have the meningitis vaccination. It's a requirement. Otherwise, the Saudis will not let you into the kingdom. You see, so there's a precedent for travel vaccines as requirements, and I think there's a good chance that will happen. In fact, before the end of the year.
Before the end of the year, yeah. So it will last for quite a while, or will it be there forever?
Yeah, so I think that this requirement, because countries are so scared. You saw what happened in Perth. Yes. One case, they locked down the whole city.
Right.
So I got a feeling that they're going to keep this requirement for at least a couple of years, the travel requirement.
All right. Okay, the next question is about the differences between the different type of vaccines. So with 3 different vaccines available, do you think that we should receive more than one vaccine? And isn't this better, or is it a double penetration?
Yeah, this is a tricky question, and all the companies and all the authorities are saying you should stick to the same vaccine. And part of the reason is because that's what they studied. You see, they studied the same vaccine. But, we don't know. So we're not sure, whether one vaccine is going to complement each other or whether they're going to contradict each other. And there's always the risk that might happen, that they cancel each other off. Because it's not always 1 + 1 = 2, you see. Sometimes 1 - 1 = 0, you see. So there's always a question about that. So we don't know.
So there's no scientific or research proven on this?
Yeah, and unfortunately there will not be for a long time, because most of the research is funded by the company. No company is going to fund research for their vaccine plus their competitor's vaccine.
Alright.
And again, that's the problem with science today. It's too commercialized.
Alright. Okay, so there has been like advantages and disadvantages for
Right.
these 3 vaccines. So in your personal opinion, which do you think is more reliable?
Yeah, the vaccines are all new, you see. One thing though, the Sinovac and the Sinopharma vaccine, as well as the Bharat Biotech vaccine developed by China and India, these use a technology which is 100 years old. What they do is basically they grow the virus in the lab, and then they kill it. They kill it using heat, radiation, or some chemical way of killing it, and then they inject it into you. And this virus is already killed, so it can't do anything to you. But it trains your body to recognize the virus, so that when the actual virus comes in, you can kill the virus. So that is a 100-year-old technology. And to be honest, if there was a company which makes flu, and that's the way we make flu vaccine every year. They grow it in chicken embryos, embryonated cells. So if there was a company which every year made the flu vaccine, made the COVID vaccine using the same technology, I would get it straight away. But there are no companies doing that. So we have no choice. So the vaccine I got was the Pfizer-BioNTech because that was the first vaccine that was available in Singapore.
So do you don't have any bias towards Sinovac or Pfizer?
I mean, there's pros and cons both ways. You see, Pfizer is, like I said, it's an established company which makes the pneumonia vaccine, which has been used in millions of people for a very long time. Sinovac generally makes vaccines for the Chinese market. See, they have very, very few vaccines which are exported outside of China. So their track record outside of China is limited. See, so we don't really know, how well these vaccines perform outside of the Chinese environment.
All right. So remember, viewers, don't choose your vaccines. Yeah, don't choose your vaccines and just take whatever is given to you. So
well, that's for now.
For now.
And again, in typical Singapore style, when the vaccine is free, you got no choice.
Yes.
I think in maybe by this time next year, you go to GP A, they have vaccine A. You go to GP B, they have vaccine B, and Singaporeans will just go and choose it whatever they want.
Okay. That will be coming in.
That would be 2022, not this year.
Not yet this year, right? Yeah. Okay, so another question is that this person has sinus and have frequent runny nose. So how would he or she know that it is due to COVID-19 or the allergies to it?
Yeah, that's a very good question. And these cases, the sporadic cases occurring in the community, people are condemning them because they had symptoms and they didn't go and see a doctor. But for a lot of people, they have allergies. And it's very hard to tell the difference between allergies and a viral infection. One clue is the loss of taste and smell. So loss of taste and smell seems to be a characteristic of COVID-19. So if you lose your taste or smell, you better go and see a doctor and get yourself swabbed. But if you just have the normal allergies, your eyes start watering, that kind of thing, then you can try and self-medicate. And if it doesn't get better after a day, then you should go and see a doctor. So, or if you're somebody who doesn't usually get allergies and then suddenly, your nose gets blocked and that kind of thing, then you need to be a bit careful. But it's very tricky and it's not easy to distinguish.
All right. So, yes, the next question is relating to the party itself. Sure. Did the party evaluate on MOH tender document on the outsourcing work to storage, processing and transport vaccine?
Yeah, of course not. In Singapore, these documents are not generally made public. We have GBIS, of course, but it's actually quite interesting because when the US FDA evaluated the vaccine, the meeting was actually live streamed. So anybody all over the world could actually watch. And I watched it. It was fascinating because you see the company presenting their data and you see people trying to shoot them down. And they were prepared for it. So they had answers to those questions. And the transcript is available online. So you can actually read the transcript of the US regulators meeting when they approved the vaccine. Unfortunately, we haven't reached that level of transparency as yet, although hopefully we will. I mean, they started live streaming Parliament. That's a good sign. That's a good first step.
I was looking forward to that also actually last year.
Yes.
So next question relating to it is that, and what is your view on the matter of whether and whether enhancement of the given clauses are necessary to ensure the vaccine is working and not spoil in the humid environment that we are staying in?
Yeah, the cold chain is really, really important. Many years ago, the hepatitis B vaccine, when it first came out, we had cases of vaccine failure, and that was tracked down actually to a cold chain problem. They were supposed to be kept in a fridge at 6 degrees centigrade, but what happened was the temperature went up to 9 degrees, so the vaccine spoiled, even though it's such a small difference.
Okay, so it's very sensitive.
It is. Vaccines tend to be very sensitive to the temperature, so there's a lot of importance to get these things done right.
All right. So at this juncture, I would like to get some questions from the FB Live itself. So first question from Alfred Hong is, what's your view on nasal spray treatment being researched in Germany?
Yeah, that's very interesting. And in fact, we did research on a throat spray treatment, and it sounds very promising. But we need to see long-term data on that. It's also hard. The vaccine, you get it one shot, you get 2 shots, and then that's it. You have to spray your nose every day. It's a bit legit, to say the least.
All right. This next question is relating to a person who still wants who takes the vaccination and wondering if he or she still gets vaccinated. Do you think it's a likelihood to get infection? I mean,
Okay, infection.
Get infection. Yeah, sorry.
So got infected first, and then whether they need to be vaccinated.
Okay. The question is like after vaccination.
Right.
So do you think he will get
Yeah.
infected
So
again?
the vaccine is not 100%. The Pfizer and the Moderna vaccines are 95%, and what that means is that if your risk of getting infection is 10%, or you 20%, then when you got vaccinated, your risk goes down to 1%. So it's not zero. See. It goes from 20 to 1. That's what 95% effective means.
All right.
So it depends on where you are. See, if you're working in Changi Airport, you're handling people, you don't know how to use your PPE properly, or the mask doesn't fit, or whatever, then you may be at risk, but your risk will be reduced significantly with vaccination, at least as far as the data that we have suggests.
Okay. I think you already answered this following question, but I think it's more appropriate if we want to scope it down.
Sure.
By George Tan, is there any risk for someone with cancer to take the vaccine?
Yeah, right now there's no evidence that people with cancer are at higher risk of complications of the vaccine. In fact, the indication is that people with cancer they are at risk of complications of the disease, so they probably should get the vaccine. The difference is, of course, if you're on chemotherapy, if you're getting large doses of chemotherapy, then there may be no point in vaccinating you because your body may not be able to mount a response. So it's probably better to vaccinate your family to protect you.
So if you're taking chemotherapy, you can't take the vaccine?
I mean, if you're taking chemotherapy, you can take the vaccine, but it's probably not advised. In fact, I think right now it's one of the relative contraindications.
All right. Yeah, sure. These are all the questions available on FB Live. And I will continue with my list of questions that we took from past few weeks. Past week. So, where did I stop? Alright, here. With question 14, which with imported cases increasing, what additional screening improvements or is there more that we can do?
Yeah, so, I think they've tried to introduce this screening on arrival at Changi Airport. And it's not easy to do, and I think it's currently being only very gradually rolled out. But that's what they do in some countries. They screen on arrival, and if people know that they're going to be screened on arrival, then they screen before they leave. But it's very difficult. The ideal situation, like I said, is vaccination. To make it like the Hajj and Umrah, there's a vaccination requirement. You must have certified completed vaccination before you come in, and then if that happens, the chances are quite high that the number of cases will drop. But that depends on the other countries having availability of vaccine.
So are you saying that the screening of this additional screening is not as effective?
I mean, the additional screening has got holes in it, see, because you get screened overseas, you don't know what's the quality of the screening. You get screened on arrival, you're already in Singapore. See? You're stuck at Changi Airport, see, so they can't put you on a plane and send you back. It's very difficult for them to do that.
Alright, so this comes to my last question on this piece of paper actually. I hope there's more questions on the FB Live. You can actually write write comment down, right? So question 15, the last of questions in my list is, why the need for vaccines for COVID but not SARS?
Yeah, the reason is actually there was a plan to have a SARS vaccine, but SARS disappeared. So there was no need for the SARS vaccine to develop, and in fact it kind of disappeared. It lost momentum. Whereas the COVID has been, there's more than 100 million cases all over the world. It sort of paralyzed the world's economy, and so that's the reason why we have to have the COVID vaccine.
So SARS didn't last for that long.
Yeah.
That makes a vaccine not suitable for that case, lah.
I think so. I mean, and again, like I said, this is one thing that really irks me is the commercialization. I mean, the SARS vaccine is something which is a public good. If we had a SARS vaccine 17 years ago or 15 years ago, it would have been a simple matter to tweak it. We wouldn't have had to wait 1 year for the vaccine. We could have got a vaccine in 3 months. But the fact is that there was no commercial value to a SARS vaccine in 2004 or 2005. So the vaccine development just ended.
All right. Okay, that's actually all about it.
Right.
We will have the next session on 9 February 2021 at exactly 8 p.m. So, but before we end the live, please do be reminded that you can actually go to Professor Paul Tambaya's Facebook to actually check out his next session that will be on the 9th of February 2021 at 8 p.m. So, well, with that, actually, but you can actually write down all the questions on the comment section, and before the session begins, the next session begins, we actually will get the questions and read through them and let Prof know that these questions are really meaningful to you guys. So with that, I will like to end this live. Any last words for you?
Yeah, thank you all for your questions. I do apologize. I think at some points in time the sound was a bit muffled, but we've tried our best. This has been very helpful to understand what are some of the concerns on the ground. We do get these questions all the time. My friends and relatives are asking me the same questions too, but it's nice to hear them from the public. So keep the questions coming. Next week we'll go into them in a bit more detail. We'll try and answer some of the other questions that have come up, and who knows what's going to happen in the week ahead. But the bottom line is though, we want you to stay healthy, to keep up to date, to make sure you have access to reliable and important information, and that's what the SDP is all about.
All right. With that, we actually would like to end this live. So remember to swarm us with lots of questions, and I think Prof Paul is he has a lot of expert in this medicine field. So yes, we'll leave you with that. Thank you and have a good night. Bye bye.
Thank you.